Good evening, everybody. My name is Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine. And I want to welcome you tonight to this evening's or this afternoon's webinar, continuing education webinar. A couple of administrative announcements before we get started. This webinar is sponsored by the American College of Veterinary Preventive Medicine and its partner organizations, the National Association of Federal Veterinarians, the American Association of Food Safety and Public Health Veterinarians, and the U.S. Animal Health Association. The 1-hour webinar has been approved by RACE. To receive a continuing education certificate, an attendee must attend 50 minutes of the 1-hour presentation. And we will send out certifications a little bit later next week. Usually it takes me 5 to 7 days to get all the verification of membership back from the partner organizations. This webinar will be recorded. It will be posted on our ACVPM YouTube page in about a week or so. We will offer an opportunity to ask Dr. Solomon, our speaker, questions at the end of the presentation. If you have a question, please enter it in the question and answer feature of Zoom. Just type your question in and we will call on you at the end of the presentation. So with that, I would like to introduce our guest speaker for this evening. For the last 37 years, Dr. Mo Solomon has been a professor in the Department of Clinical Sciences and is the founder and director of the Animal Population Health Institute of the College of Veterinary Medicine and Biomedical Sciences at Colorado State University. He holds a bachelor's of veterinary medical science, a master's in veterinary preventive medicine, and a PhD in comparative pathology. Dr. Solomon is a diplomate of the American College of Veterinary Preventive Medicine and a fellow of the American College of Epidemiology. His research interests focus on surveillance and survey methodologies for animal diseases, with emphasis on infectious diseases and zoonoses. Many of his research activities are engaged in stabilization and reconstruction of national animal health and public health programs in countries such as Bosnia, Afghanistan, Iraq, the Middle East, East Africa, Georgia, and Armenia, among others. So the ACVPM would like to offer a warm welcome to Dr. Mo Solomon.
Thank you so much, Dr. Toren, and I hope people could hear me, and if you cannot, you could either send through chat or question and answer if there is a technical problem. Good day, everybody, and I'm being flattered to be accepted for presenting the topic about the principle of preventive veterinary medicine and biosecurity using a title from conception to consumption. Since this is like a continuing education session, I thought I will follow the rules and give you some learning objectives that I could I'm planning to cover, and you could really check on me if I don't cover it in that respect. Mainly this is like to utilize and apply some of the principles and the tools for the topic of the biosecurity through prevention and control measures. And then I will talk a little bit about biosecurity and biosafety, and very limited about the prevention and therapy on a population basis. And finally, I will maybe mention about the HACCP and the risk assessment process in that respect. The most important part in my presentation for today is to show some demonstration to clarify issues and topic to be will be addressed in today. I feel like, and these topics, these terms are being used a lot these days, and sometimes they're abused, and sometimes are confused to even the professional people in that respect. I admitted that I borrowed some slides about these topics from my previous presentations in the early 1990s, but also in the 2005 when I presented similar topic in the annual conference of the AVMA. And I thought, like, since the topics now is still hot, and also some of us are young and they don't remember like these days when maybe they were still young people and not be involved in this profession, thought like I will do my best to remind everybody. The other claim I would like to say is maybe some of these what I will present, it will be very basic for majority of you, and I hope it will be very basic and maybe so boring because probably you say what we have heard about that. So I thought like maybe to do some demonstrations just to remind you of these concept and the principles and of these topics. Since we talk about concept and application, I want to maybe address the issue about the title I used, conception to consumption. Some of you probably have heard this term. I use it instead of farms to fork, especially when you talk about food safety. I really feel like, especially in veterinary practice, we do things from the conception of the animals all the way where either the animals or its products will be consumed. But I use this mainly because I feel like we need to emphasize on the difference between the principles and the concept. And I think sometimes we mix the two together and they are related. But I think the principles is really like related to the characteristics of whatever the concept we want to talk about. And sometimes we could see what I would refer to as the essentials instead of the principles, which I think is important. I compare that to food recipes versus food ingredients. You cannot have food recipes without having food ingredients, and also food ingredients by itself without putting them into a real recipe or a dish would not be a good way to utilize that. And you could see like also I believe in food because I am a really like eating a lot and hunger for food all the time. It's the difference between dining and eating. Eating is mainly essential part of the metabolic process we need in any living body, whereas the dining in a lot of ways is the luxury of enjoying food in that respect. So as I indicated in the previous slide, is mainly what I would like to utilize or emphasize on the appropriate use of tools versus the abuse of any given tool, especially when it's come to preventive veterinary medicine in that respect. So the first section I want to focus is on the prevention and control as disease management, or how we could manage disease in that respect. And I emphasize is the management of the disease is that what in my opinion is the most important or an ultimate goal for whatever we do in terms of the profession of veterinary medicine, or in that matter, even in human medicine. But I would like to address those, and because of the how we deal with the biosecurity in terms of its concept and its required elements. However, to understand the biosecurity concept and its elements, then we need to go back and understand what's the meaning and the prevention and the control as a disease management in that respect. So I put like mainly is to start for this topic is I put like two like challenging questions. The first one, what's the difference in the method we applied, only the method we applied to prevent a disease from those to control the same disease? what are if there are differences, what are these? And the second one, who cares? If there is a difference in that way. I hope going through that, maybe like we can like convince you is like there is a need to understand the concept in order to apply it in that way. So for that purpose, I really would like to focus on what the lesson we gained from a previous application of these two terms and how we can apply them in general. So to start with, I thought like maybe I go back to these three terms in disease management: prevention, control, and eradication. And I'm planning to go through each of them and with some demonstrations about what we mean by those, and not only in a theoretical or in a textbook style. However, we cannot avoid the textbook style. So the first thing I want to just mainly give the definition. So when we said prevention is mainly we are talking about the exclusion of a disease from a population of unaffected people or animals in that way. So here is, I emphasize on the exclusion of a disease or a group of diseases in that matter, but they should be unaffected. So they do not have the disease, or they don't have any type of like health status to relate it to that disease, and that's what we call the exclusion. How we accomplish this type of exclusion? The most important, and that being conventionally recognized, is the quarantine of potentially sick or exposed individual, and mainly so we can exclude them from the, let's call it, healthy population. It's an interesting part, at least for me, prior to the COVID-19, the term or the word quarantine was not so much used. I believe like now you could hear it, and even in the social media and the public, you hear this term quarantine a lot, okay? That because it's before COVID-19, especially in the public health aspect, we did not really like apply or practice that for centuries in that way. However, in veterinary medicine, we've been practicing quarantine or isolation for several diseases, particularly when we talk about like zoonotic diseases such as rabies, but also when we talk about diseases that's very highly contagious or at least have some trade issues such as tuberculosis and brucellosis, or other and even in animal shelters or dog shelters when we have the coughing diseases related to the shelter in that way. However, there is a condition for using the quarantine, and mainly to require the prior knowledge about the disease agent, and specifically about in this incubation period. So if we don't know the disease agent, or we cannot measure the disease agent, using the quarantine, it will be useless and it will not be effective in that way. I really recently, and I will elaborate more actually during the last a few days, when we listen to the health, let's call it decision makers, whether in the United States or abroad, and when they talk about changing the type of quarantine and isolation for travelers, they now is trying to also change it because of the knowledge about the new strain with its incubation period. That really is an example how the quarantine should have that type of knowledge before it can be addressed in that way. So I give this as maybe an example of these diseases so you can have an idea what we are talking about. Another method for the exclusion as part of the prevention is the prior testing of individuals. is a type of exclusion of a disease. So here is like that where if we find an individual that is positive, then similar to the quarantine, we try to isolate that person or that animals from the rest of the, let's call them healthy population as much as possible. Again, it will require some prior, let's call it conditions in that way. Well, first and most important is availability of a screening and diagnosis test or test in that respect. But the most important part in that respect is to have the confidence in the negative test results. Last month, you heard about like what's the meaning of the predicted values of negative. Here is, I call it negative or confidence in the negative test result. It's the same thing, but here it's more on the clinical application in that respect. Here is we could see it, especially now in COVID-19, how we can utilize this and mainly to identify potential infected and infectious individuals so we can eliminate them, or excuse me, what elimination is not like killing them. Well, mainly like isolating them from the rest of the population as much as possible. So this is, when I said elimination, this is mainly what I mean in the veterinary side is we have used this type of prior testing of individual animals or even prior testing of herds as an example of the isolation and the quarantine. It's been very effective and successful method for the prevention of spread of a disease through this exclusion, such as we have with the brucellosis. Again, I go back to the rabies. The reason is like we test sometimes let's say like rabid dogs or suspect rabid dogs, and mainly so we can confirm whether the dog is infected or not with the rabies virus. Again, here is I would like to emphasize is we really don't care a lot about the predicted values of the positive. Most important is the confidence on the predicted values of the negative outcome from either one or several tests in that respect. And the reason behind this one is because as soon as we said this individual doesn't have that particular disease, that individual can be part of the, let's call them healthy populations. And that's where actually the practice now with COVID-19, when you travel overseas or whenever countries, that's where, and when they said we will require test and we require the test to be negative before you come there. So, but unfortunately, not so much like address the issue, what confidence we have in the available test in terms of giving negative test result. But that's not part of today's topics that we need to talk about. Another dimension to the prevention is the protection. If you remember, we said the exclusion. The protection of the people or animal when the disease is present is we call also prevention. Here is like, again, we are talking about a prevention but here is the disease is present in the population. But when we want to protect those individuals within the population that they don't have the disease in that respect. What we have used for the method of the protection, the most important and the most really being recognized method is the immunizations. And we will talk a little bit later about the vaccination as a proxy for what we mean by immunization. But also another method is the chemoprophylactics. And now you hear some of the companies, like I just listened to the news, and that's only could be rumors, could be fake news, could be true news. I really don't know. But Pfizer is thinking to have like let's call the antivirus pills that it can be used across all the population to protect us from the SARS-CoV-2 in that respect. So that's what we mean by the chemoprophylaxis in that way. In veterinary medicine, this is being used a lot, and especially in like high density population of animals such as poultry or swine, in which like that it can be utilized in that way. Another method of protection is the environmental sanitation and the vector controls. Environmental sanitation, now all of us are experienced with how we try to maintain as much as possible clean hands, a clean face, clean body too, okay, as much as possible as part of to protect us from the potential circulation of the virus, the COVID virus in the population in that way. The vector controls, a lot of us are familiar what happened with the West Nile virus, and when it came to the United States, how the vector controls was used to protect both the human and the equine population in that respect. Another method of protection is the genetic engineers. And that's, of course, I'm really talking here genetically or genetic engineering mainly in the animal side, and also the selective breeding. But it has some like pros and cons in that respect, but it's being used. Okay, and I think I have a good example is what the layers now in the United States, majority of them are bred for being salmonella, less shedding of the eggs. So that way is we have less shedding of the salmonella when we eat eggs in that respect. And finally, which I think is a lot of now attention to it, and I fortunately now because of the COVID, is the public awareness and education. Actually, I feel like my topic today is mainly related to public awareness and education on why we need the prevention and why we need the control and for pandemics such as what we are suffering now with the COVID-19. So the public awareness and the education is very important, but it has to be, it's in a lot of ways, like simple messages and scientifically based, but also to be understood by the layman in that respect. It's really sad these days when I hear from even scientists that they don't differentiate between infection, infectious, and disease and inflammation. That's not a good, I like to say, good message when it comes from scientists and that they can communicate with the public in that respect. Let's move to the disease control. What do we mean by disease control? We mean it's all the measures and whatever efforts we do to reduce the frequency of a disease in a population, both sick and healthy. Okay, so that's where in the beginning of the COVID outbreak or pandemic, you hear a lot about flattening the curve. Flattening the curve. Some of you and majority of you probably know about the epidemic curve, and in such way is what we are trying to do with any or all of the disease control to reduce the area under the curve in the epidemic curve. And that's where we call it the disease control. So all of the efforts and the measure in that way, it can be put together. So the way I see it is prevention and control measures or a program is mainly a continuing effort. So it really goes from one to the other. And I don't think there is really a need to say, here is the line of demarcation, except when you try to assess specific controls or prevention strategies and to see about its aim in that respect. So how we do the control is, as I just indicated, the prevention, that all of the two, the protection and the exclusion, will be part of it. Another one is by decrease the communicability and the contacts, okay? So mainly like how we reduce now is, people call it like for the COVID-19, social distancing. First of all, I don't like to use social distancing, because here the distancing is not to reduce our social interaction, but is mainly to reduce the exposure and the contacts with the virus itself. But also could be an increased resistance and also the early detection. We hear a lot about early detection these days, but the reason for the early detection is mainly to satisfy what the definition of the control by reducing the impact of the disease, by reducing the area under the curve of the epidemic curve, in my opinion, and that will be important. The way I see, like, all the preventive measures are part of the control approaches, okay, but not the opposite. So it's almost like the prevention is mainly the core for the control in that respect. I have a couple of slides a little bit to elaborate on some of the components of the control that is beside the prevention that I mentioned. So decreased communicability and contacts is mainly to work with the herd immunity. And by the way, herd immunity, I really would like to say, has two main components. The first component is the contact rate, and the second component is the susceptibility, or the proportion of the susceptible individuals within the population we deal with. Is a concept, is not like what now is, especially mathematicians and physicians are taking it in such way and use this absolute figures, like they say herd immunity is 7, herd immunity is 2. These are, in my opinion, is just only a relative figures. The concept is more important, and the concept is where the control measures work all together. So the decreased communicability is mainly to increase herd immunity through a reduction in contacts, but also it's through we can do it through segregation of individual animals, similar to or individual person, similar to the example I used before. The other part of the decreased communicability and contact is the example I will use in veterinary medicine is closed herds, all in, all out practices. These are, in my opinion, even though is built because of the economic and the practicality, but they have scientific principles to improve the herd immunity among the population that we are addressing in that respect. It's hard to apply when you have a dynamic population, such as communities or cities or animal shelters, etc. When I mean by dynamic, when population ins and outs, they go so far, and also diversity in the population in that respect. Currently, some of the cities and communities are practicing this decrease in communicability through this approach by just mainly obtaining the mask, for example, screening for vaccination status of the people, they go inside, and also by keeping as much as possible a low density of the population in a given place, such as a restaurant. And like I was in New York City last week, and you cannot go to a restaurant without showing your vaccination status, and you maintain the mask when you sit, but also to maintain some distance between the different customers in that way. In my opinion, that's part of the concept of the herd immunity, using the concept of decreased communicability. And the reason also I said, like, it's hard to apply with the dynamic population, but it's very easy to apply in the homogeneous and steady population. And that's the reason you see it, for example, in poultry, in swine operation, and less likely to see it in, like, let's say, like in a cow-calf operation, or even in shelters because of the dynamic, animal shelters, because of the dynamic in that way. One slide about eradication. What we mean by eradication is elimination of the agent from a specific geographic region or premises, as well as from specific or selected host species. And in this way, it's a very, let's call it like, is the ultimate goal in any type of a disease management, because that's what we want to reach. And I can predict, like, within the next couple of years, we will talk about SARS-CoV-2 in terms of the eradication, even though I think it's very hard because it's difficult to accomplish. And furthermore, which is more important, is difficult to maintain. Once you establish it, or establish eradication or a status of eradication, then you have to maintain it in a population. And that's the difficult part in that way. And it's also should be, because of that reason, should be focused on either a specific region or premises or shelters or homes or community, instead of trying to apply it in a very global part in that way. So for the first section is really the take-home message that prevention and control measures are continuous. Okay, there is, as I said, no line of demarcation between the two, but we need to know what's the aim in any type of plannings. And the tools are depending on the aim and the target populations. There are several tools that we can apply, and all of them have some, let's call it, advantages and disadvantages, but it cannot, it needs to be know what's the aim in that way. And no single action against a disease is sufficient to manage the disease. Whoever will say, like, is one action such as like what we hear now, go and get the vaccination and you will be safe in the community. Maybe the individual will be safe, but the disease and the virus and the infection will not be like the vaccination will be sufficient to maintain or to eradicate the disease in that way. Disease management requires prior knowledge about the epidemiology of the disease, and there are appropriate tools to collect that. This is where I feel like during the last 18 months or maybe 2 years is, unfortunately, the community started to attack the scientists in some way, because they will say something and the next day they will say, well, maybe this is not correct. And mainly because we are going through the embryonic stage of collection of, let's say, information about this virus and how it will behave in a population. When I said embryonic stage, this is like, it's like almost we building every day on more knowledge that we need to know, and therefore we change the management of the disease according to the knowledge and according to the limitations of the tools we are using, including the limitation of the how to measure the disease in using some of the tools or some of the tests, excuse me. But however, scientific facts and other related factors, and I really feel like that's very important to emphasize on the social, the political, and the environmental condition should be considered before a set of action is recommended. What we will work, for example, in the state of Colorado, maybe it will not work in the state of Mississippi. I said maybe. So we need to see how we can adjust all of the, let's say, the factors and consider the social, the political, and the environmental condition in that respect. I feel like in veterinary medicine, we have really built on a good adjustment, mainly because the industry push us to do that. The clients push us to do that. So we have much more, in my opinion, prepared to deal with or to have flexibility, not only to deal with, but to have flexibility in managing diseases as compared to the public health in that respect. It's not, I blame it on the public health, but also I think is because of the condition we deal with. Let me move a little bit now is on biosecurity. I spent the first 30 minutes on the others, but now is I go back to the core of this presentation. Everybody is now know how even to spell biosecurity in our community, including myself. I'm very poor spellers in that way. So what we mean here is all the efforts designated or designed to reduce the risk of introduction and dissemination. I will emphasize the risk for introduction and dissemination of any adverse health hazards or agents. It's an essential element in the preventive medicine, and mainly through the control. It's more than just the quarantine or isolation, as like a lot of the people now, they think when biosecurity means quarantine. That's not only the quarantine, although the quarantine can play a major role in that way. It's more than applicable into only a clinic or a shelter or a premises. I think the COVID-19, the ASF, the African swine fever, what's going on now, both of those give us more appreciation about biosecurity in terms of community on a region or a nation, etc. And it is, in my opinion, has more challenges in veterinary facilities as compared to the human facilities, such as a human hospital in that way. I want to just differentiate between what we mean by biosecurity versus biosafety. Again, unfortunately, these two terms are used interchangeably, but they should not. So biosafety is, and this is I used it way back in 2001, actually, this definition. All hygienes are designed to protect human population from the risk of introduction and dissemination of adverse human health. Here is protect human population. That's the reason it's called biosafety. Again, it's an essential element in preventive medicine. It's part of the biosecurity, okay? It's mostly applied to the laboratory premises, and it's applicable, especially in the veterinary facilities and when we deal with the zoonotic agents. So for example, when a biosafety officer to talk about African swine fever and say, well, we need to apply biosafety for African swine fever virus, it's, in my opinion, that term is used wrongly because it's meant is the ASF virus has a zoonotic characteristics. It doesn't have a zoonotic characteristics in terms of the direct safety of the laboratory people, but maybe it has an indirect way through the food security and etc. So the term should be biosecurity and not biosafety in that way. Another term is used, the biocontainment, and that one is mainly the effort to design to bonds to constrain the risk of dissemination or escape of adverse health, mainly in the hazards containers. The hazards containers is those that they have like any type of that type of let's call it like a dangerous hazards, as I said in one of these my bullet statement, is a special case of biosecurity. Is mainly applied when there is a dangerous hazards. Is majority of the time is used in either laboratory or storage area for hazardous materials, and also is applicable to dangerous and threat agents in veterinary facilities, and is essential element again for preventive medicine. I will give an example about the biocontainment. A lot of you know about like rinderpest, a virus is globally eradicated from like all the world. However, there are quite a few, like I should say quite few laboratories in which they do still have the virus itself. Okay, and mainly to as a like in a stocks for if they need for production of vaccine, at least is available. These laboratories will require a biocontainment because the escape of that virus could be a serious global dangerous that we need to avoid in that way. So that's where I think is the example as compared to the biosafety and biosecurity. So if I like to see it in a picture, the relationship between these three terms, biosecurity is mainly the global aspect of everything, and the biosafety and the biocontainment is within the biosecurity, and the biocontainment is overlap between the biosafety and the entire biosecurity, especially when related to viruses like or agents, excuse me, that they have no impact on the human health in that respect. The way we talk about the scope of biosecurity, as I said in the beginning, is really could go all the way from the farm level to the national, to regional, and also to the global level, as we currently deal with the ASF, the African swine fever, in which like certain international organization, they want to establish some biosecurity guidelines in terms of the global level, and that can be recommended in general. Regardless of what we deal with the biosecurity, I like to present this slide way back I presented is to ask question about which system, and especially here about food producing animals, which system is more vulnerable to disease introduction and disease spread? Is it the one with homogeneous population or the one with the diversified population and with the diversified resources in that way? The latter is in my opinion, is less vulnerable as compared to the one in which everything is homogeneous. Because with the homogeneous is almost, we are inviting the pathogens, and if I talk about infectious diseases, in terms of having unique host population, but in large number of them, that it can work in that way. So that's where I like to say is you need to be very careful in applying biosecurity by knowing is about the background on and the population you deal with in that respect. a few slides about what's the essential element for biosecurity. I like to say there are three elements that we need to consider, or three components that we need to consider in that way. The exclusion, and mainly to maintain the pathogens or any hazards outside of the premises. And the second one is the checking for the unexpected through the monitoring the health status. And the third one is the intervention, or sometimes we call the response, by having a plan in that way. I want to elaborate a little bit about each of those, but before I elaborate, I want to say is these three components cannot work independently. They have to work in an interactive way. Otherwise, the biosecurity soundness will not be good without looking in that way. However, I will address them into each of them as a component, mainly to give you some ideas about what we are dealing with. First, with the exclusion. Pathogens can move within animals or population. That's a fact that we cannot avoid. Zero risk also does not exist, because if there is zero risk, then we should restrict all of the our movement and life in general. I think is we need to accept certain risk in that way, and we move with it in that. And that's where it comes like movement of animals is very important. And relying solely on the quarantine or isolation is usually not adequate. The example I have from the current outbreak in what happened in Australia and in New Zealand, in which like they try to exclude themselves through the quarantine or isolation, and it didn't work perfectly. It did have been very effective, but it didn't work as is in that way. So it needs more done that way. How to measure the exclusion is, or what type of measures we use for exclusion, not how to measure it, is first we detect the agent through the screening process. That's what currently we are doing with both the COVID, but also with ASF. We need to check for the origin, the sources. That's what we do with the trace back and trace forward in terms of like when we get infected individuals or infected community, then we go and try to see where. We should also restrict to trafficking. That's part of the exclusion, as much as we can do with the separation in that way. And the segregation of the group and movement restriction is a very important. That's where actually we observed in China last year, 2020, when they restrict the movement of pigs from one province to the other, how the ASF got down in the entire country. Vietnam followed the same thing, but Vietnam now, it has more, during the last month, more ASF because they relaxed that type of measures in that respect. And we depend on the overall sensitivity of the system in terms of measure of the exclusion. The overall sensitivity means we should, as much as possible, reduce the number of the false negative in the population. And therefore, again, we should have confidence in the exclusion measure through the predicted values of the negative, because those will stay in the population. However, it will require some overall specificity of the system. We should avoid as much as possible the false alarm, but it should not be like eliminate or zero false positive alarm. If there is zero false positive alarm in the system, that means is your overall specificity, or assuming like the overall specificity is 100%, and that's not realistic. Another one is about the checking for unexpected. Is monitoring program is very important, including like production parameters, and especially in the food producing animals. It's it's mainly determine the health status of the population. The COVID-19 now would get us attention to the senior citizens locations and also the like assisted living places. Why? Because they are under the risk, and we need to monitor their entire health status, because with this virus, we know is with the immunocompromised people, they will have more ability to spread the infection. Its benefit is beyond the only biosecurity. It's beyond that way. It will require resources and interest. It's not easy to say it without having the reliable professional people to do the monitoring, but also to interpret data, but also to maintain like certain level of like what they should do and in certain aspect of the disease status. And measuring the unexpected is usually will require some measure or require some actions. One, the actions is mainly to keep and good observation, and that by itself will require a systematic collection of information and data. I just came from a wonderful talk from the health advisor for the White House, in which like he emphasized on the importance of reliable and collection of data for the future if we want to be more prepared for infectious diseases in that way. The syndromic monitoring system is a really good way for checking for the unexpected or in that way. Again, I would like to emphasize like negative reporting is essential component of effective monitoring system. That what I mean by like is to say not only to focus on the positive, but how many of them are negative in that respect. The current application of what is called the dashboard by certain Department of Health in counties and states is a good example. However, some of these dashboards will focus on the positive, but they don't give you how many negatives and where are these negatives are. So the notification is very important in a population in that way. And I would say here is in veterinary medicine, we need another issue, which I didn't include here, is the protection of the data and information and in terms of the confidentiality, so we can have the industry and the community to trust us and work with us in that way. And finally, the third component is the intervention, okay? And should be ready for the worst case scenario. And that should have a plan. And the plan should be practical and executable. Unfortunately, and we learn our lesson, like we did not have a good plan on a community basis that addressed by the community health or public health before we get the COVID in that way. And that will require a lot of what I call demonstrations, and also to have like maybe some exercises and tabletop exercises to see if the plan is capable to do that. Fortunately, in veterinary medicine, and especially with some of the, let's say, transboundary animal diseases, with the help of the USDA and state veterinarians, they really have done this through some of these aspects. And it needs to keep a list of important pathogens and disease with the possible intervention measures. I think is the example, I have a good example, is the current efforts to maintain good data about the influenza virus and the different mutation and different strains that is circulated in both humans and in animals in that way. And coordinate with the other related industry and local health entities. That is, I think, is important. What are the measures is for the intervention is the vaccination. I mentioned about like how the vaccination should not be the silver bullet, but we need to think about, is it reasonable or not? Cleaning and disinfection is another good intervention we need to consider in that way. However, I'm more concerned now with the amount of the use of alcohol and disinfection that we are building, let's call it superbugs, especially bacteria, that it can be circulated in the future. A treatment and use of mass treatment as a preventive measure should be considered, but also to consider the environment and then impact. And when we talk about animals, we need also to consider how to destroy the infected animals and how with less impact on the environment in that way. I show this slide mainly to give you an idea, like, is not only what I present in a theoretical part. This is a slide we used for training during the epidemic now in Southeast Asia for the African swine fever. And just you could see from the list is mainly something that can common sense, but will require some practice and some understanding why we do, all the way from hand washing to the vaccination status in that way. So what is needed in biosecurity, and that's almost I want to end my presentation. It needs participation and collection of baseline data. We need to customize checklists to the specific sectors. And currently there are few circulating biosecurity checklists that it can be customized for a different sector of the veterinary medicine, but also even in the community or the health or public health aspect in that way. We need to stay within the limitation and the constraint in applying specific measures, not to promise something it cannot really work well. And also we need to consider the negative impact on the environment in our assessing any type of a strategy. And that I would like to say, well, we need to think about the total working environment health. This is COVID give us a good lesson. We cannot work in a silo, like the animal side is not related to the workers, or the workers are not related to the animal side. So there is now a good movement is to build on total working environment health, in which the workers is part of the production system in that way. And we need to work in an interdisciplinary approach in which, like, our aim is the social well-being or the community well-being instead of anything else. And finally, and I know it's just maybe a few slides about what's the HACCP and what's the risk analysis in that way. Risk analysis is mainly, they have the 4 components, okay, is the hazard identification, risk assessment, and risk management and risk communication. When we talk about hazards analysis and for critical control points, what's called HACCP, is mainly applied in food safety and others, but is a systematic approach, is mainly to evaluate risk and design and evaluate mitigation for the as a control system in that way. It's really a good general approach designed to the operation of specific program and mainly for food safety, as I said, but is extremely useful of infectious disease control program. I look at the HACCP as part of the risk analysis, is a good component, is a good demonstration in that respect we need to consider. And that's, I think, how the relationship between risk analysis as a scientific base and the HACCP is a scientific base, but a special demonstration of the risk analysis. So the way I see disease management, and that's my last slide, is mainly a common sense with a system. And what we mean by a system, we need to have good understanding and observation of the real life situation, but also we need to have tools, and each tool how to be used with the limitation in order to apply it to the common sense with the system. And I stop here and thank you so much. And I am sorry, I think is maybe like not so much time for question and answer. I'm available, but I think I will leave it for the moderator to decide when we will finish.
Well, Dr. Selman, we still have some folks on the line, and we do have one question. Anonymous attendee, the individual didn't provide a name, so I will just read the question off. Do you have any thoughts on how one would approach a multi-species disease with a long incubation period during which the individual is infectious in a migratory population?
Very good question. And I can tell you the short answer, we have to explore more than one approach. And this is what happened. For example, I used the example of BSE, bovine spongiform encephalopathy, or the other name for it, blame somebody else. I feel like it's, even though it's not considered a multi-species, but it is multi-species, okay? And the approach there is mainly to focus on alternative to the, let's say, the isolation or the quarantine. Focus on like the manageable high risk factors. And in this situation, for example, it was mainly related to like the source of feed, okay? And how you could maybe try to say, well, if the source of the feed is SRM or specified risk material, or coming from specified risk material, or from ruminants, you stop that, and that's where it really worked in that way. I can tell you is the example about like what happened with the H1N1, what it started as swine flu or swine influenza. That's another example, because again, here is multi-species, and I love the way Canada approached it through a cartoon when the public health in Canada, where they showed the pigs, okay, without mask, and the people entering to the pigs with mask, because at that time, even though in the public opinion is the virus source is the pigs, where they provide evidence in Canada, the source is the human that it can share it with the pigs. So that's another, what I said, like we need to go back to the source and the risk factor before we move forward.
Another question has popped in. First of all, a compliment from Dr. Lonnie Ware. Wonderful presentation. Her question is, what role do you think biosecurity plays in global food security? Is the lack of robust biosecurity programs a threat to food security for humans and animals?
The short answer is yes, and it's a very important question in my opinion. Yes, it is a threat, and I feel like we have solution to have less, let's call it less food vulnerability or less food insecurity by implementing reliable and practical biosecurity items, whether it's on a regional level or even on like a village level, that it can help. Is the model we have in Indonesia during the H5N1 in 2006, and how biosecurity played a major role and maintain the supply or the food chain. That's a really good demonstration in that way. And also what happened with the Ebola in Africa in terms of like stopping the supply of food is another example of like there is a need for the biosecurity in that respect.
Excellent. I definitely appreciate you answering those questions, Dr. Solomon. I think that's well, I think one more popped in and people are still on. A question from Dr. Scher. What do you think about strengthening active and passive surveillance in terms of tracing and controlling foodborne outbreaks?
It's a very good, effective method. I really don't want to differentiate between active and passive surveillance because I usually will say surveillance should be with action. Okay. The active and passive is mainly in the collection of the data. I think is currently in foodborne diseases and food inspection in general, I feel like it can be significantly improved. And I can tell you that can help in both the quality of the food, okay, by expanding on let's say the shelf time for the food, but also to build better confidence in the consumers in terms of what they eat and what it can be eaten. I think is the reduction in our inspection, the reduction in our investigation of foodborne illness will hurt the entire food supply system in the long run, in my opinion.
Thank you again, Dr. Solomon, for answering that final question. We're going to go ahead and close it out tonight. And at this time, I would like to turn it over to Dr. Suzanne Tomasi, the chair of our ACVPM Continuing Education Committee.
Thank you. And thank you, Dr. Solomon, for an amazing presentation. It was very informative. And for those who are planning on taking the boards, could be very helpful, and probably I recommend rewatching it before you go and sit for your boards this year. I'd like to thank everybody for coming, especially on a Friday night. And again, reminded everybody, we are always looking for speakers for now 2022. So if you have any ideas, please email Eric or Dr. Turing with your suggestions, and we'll follow up and see if we can get them scheduled. Thank you again, everyone, and have a great night.
Okay. Thanks. Everybody have a great night. Thank you, everybody, and happy holidays.